Hello there, welcome back to my channel. It's your everydayness Abby. So we are continuing our discussion on bipolar affective disorder. In our previous discussion, we talked about the causes of bipolar affective disorder or how bipolar affective disorder comes about. So in today's video, we are going to talk about the triggers for bipolar affective disorder. Please don't forget to subscribe to my channel, like, and also share. Let's get into our video for today. The first trigger we'll be talking about. Okay, before that, let me explain what triggers are. So triggers are the things that we go through that puts us into an episode of our condition. So there are things that are in our environment, things that are within, things that we take in that alters certain things in our body, and then in turn bringing or leading us into getting an episode. So in this case, we are going to talk about few things that when you do or few things that have when happens to you can lead you to having an episode of bipolar affective disorder. So the first thing we'll be talking about is stress. Stress. We know that stress is all around us. We find it at our workplaces, in the home, in school, wherever we find ourselves, there is stress. But we are saying that too much of the stress can trigger your condition. Maybe when you are in a toxic relationship, it could be that so much pressure from work, it could be that so much pressure from school, or a lot of pressure from your environment. So when you go through a lot of stress, it can trigger your condition. So it is best for you to minimize stress. When you are tired, ensure that you rest. You don't really engage or push yourself too much or too hard to the point where you are stressed, so that it triggers your condition. Another thing we'll talk about is use of substance or substance abuse. Chemicals like alcohol, marijuana, petadine, um, nicotine, all these hard drugs, okay, not just these few mentioned, but all these hard drugs, they are able to alter our brain chemicals. And we know that these brain chemicals, those neurotransmitters, they regulate our moods, our behavior, and certain things in our body. So when you take these drugs, they are able to alter the brain chemicals in your brain, thereby making those chemicals more or less. Or other times they can even cause a fluctuation in these brain chemicals. When that happens, it can lead you to having an episode of your condition. So it is best that you stop or avoid taking these drugs when you are diagnosed of bipolar affective disorder or any other mental condition, because it can lead your condition to become worse or it can trigger it. We also have quitting treatment, or quitting treatment in the sense that you stop taking your medication, you stop going for reviews, you stop going for therapy or counseling. All these things help in managing your condition. Most people feel that sometimes when they take the medication for a very long time and things are okay, they feel like they are fine and they can stop taking the medication. Other times, too, the side effect of the medication or them eating too much or sleeping too much lead them to stop taking the medication. When you do that, it triggers your condition or it causes you to go into relapse. So you see, bipolar is a chronic condition that you have to be on medication for life. Just that there are times where you would go off the medication when your doctor says so, and there are times where you would be put back on the medication. So you have to work with your doctor. You have to ensure that everything you do, your doctor is involved so that you don't worsen your condition or you don't trigger it. We also have hormonal level fluctuation. This is mostly in women. You know that when we are going through our menstrual cycle, we have hormones in our body becoming high or they increase um, in their amount, like estrogen, progesterone, they become more so that we can go through the cycle. And in the process, when they are increasing in our body, they cause fluctuation in our moods. We get mood swings. So during those times too, your episode can be triggered. your episode can be triggered. So you have to take care of yourself, have family around you, engage in activities that will not trigger your condition. And in times too, when we get pregnant, as in when we do not menstruate and we get pregnant, these hormones become more in our system. So it also brings about fluctuations in our moods. We know that when you are pregnant, there are a lot of hormonal changes and mood swings. So if you already have bipolar affective disorder, it becomes the incidents become more. That means you are at high rates of your condition being triggered. So that means pregnancy is also one of the triggers of bipolar affective disorder. Another trigger is childbirth. So if even you don't have that mood swings in pregnancy, when you deliver or when you give birth, the hormones in your body now drops down. They suddenly drops. And that drop can also lead to fluctuations in your mood and can also trigger your condition. So you have to speak to your doctor if you have bipolar affective disorder when going through pregnancy so that interventions can be given, or you can be put on medication, or your medication dose can be increased to help you go through the episode. We also have lack of family support. We know that the family is very vital when you are going through or when you are diagnosed with bipolar affective disorder. They have to support you, they have to care for you, they have to love you, they have to give you all that you need so that you can go through the treatment process successfully. In cases where the family support is not there and the person feels like he is alone or there is no one around them to love them or to care for them, it can trigger their condition. So it's important that the family supports them. They do not get tired of giving them the love and the support. It is very, very important that you get all that. We also have fear and anxiety. Fear and anxiety. Sometimes pressures from life or expectation of people causes you to become anxious or to develop some form of fear. Maybe you are going to write an exams, maybe demand from your boss, demand from your husband, your wife, of which you cannot give because of your condition. It can also trigger an episode. So it is important that your spouse, or as in people around you, your workplace, your boss in school, they get to understand what you are going through and give you more time to go through or to perform tasks so that it would help you to overcome your condition or to overcome your triggers. So there are a whole lot of triggers to talk about, but these are a few of them. These are a few that we will talk about. Please, 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 let's take good care of ourselves and avoid these stresses. One important thing is that you have to also study yourself and know your triggers. Okay, the triggers are different for everybody because we are different. Yes, so you have to pay particular attention to your triggers and then study yourself. So that when you get to know your triggers, you speak to your doctor about it or your therapist about it, so that interventions can be put in place to help you better manage yourself. So it's your everyday nurse Abby. Please don't forget to subscribe to my channel, like, and also share.